Assalamu alaikum dear students. Today we will discuss the most important topic is RBC disorders MCQs part 2nd. Major site for folic acid absorption: option A duodenum, B stomach, option C colon. Correct option is A duodenum. Megaloblastic anemia occurs due to a deficiency of option A niacin, B cobalamin, C riboflavin, option D thiamine. Correct option is B cobalamin. Antibiotics that may cause megaloblastic anemia: option A ciprofloxacin, B azithromycin, C ceftriaxone, and option D methotrexate. Correct option is D methotrexate. The Donat-Landsteiner test is used for diagnosis of paroxysmal cold hemoglobinuria, B hemolytic anemia, C autoimmune hemolytic anemia, and option D iron deficiency anemia. So the correct option is A paroxysmal cold hemoglobinuria. Hematobiotic diseases may better be diagnosed by option A X-ray, B complete blood count, C bone marrow examination, and option D ultrasound. Correct option is C bone marrow examination. A major clinical feature of cold immune hemolytic anemia is option A dehydration, B fatigue, C acrocyanosis, and option D vasculitis. So the correct option is C acrocyanosis. Megaloblastic anemia may occur due to option A intrinsic factor deficiency, B B12 deficiency, C both A and B, and option D iron deficiency. Correct option is C both A and B. It is a sign of megaloblastic anemia: option A gingivitis, B glossitis, C pharyngitis, and option D tonsillitis. So the correct option is B glossitis. Folate in the blood is present in the form of option A folic acid, B dihydrofolate, C tetrahydrofolate, option D hydroxyfolate. So the correct option is C tetrahydrofolate. The Schilling test is related to option A vitamin B12 absorption, B folate metabolism, C RBC formation, and option D blood transfusion. So the correct option is A vitamin B12 absorption. Lab findings in megaloblastic anemia: option A anisocytosis, B poikilocytosis, C Cabot rings, option D all of the above. Correct option is D all of the above. Which type of condition is directly related to the bone marrow suppression? Option A aplastic anemia, B sickle cell anemia, C hemolytic anemia, option D megaloblastic anemia, and option E, iron deficiency. Correct option is A, aplastic anemia. RBCs survive around option A, 80 days, B, 100 days, C, 120 days, option D, 160 days. Correct option is C, 120 days. The most important antibody in erythroblastosis fetilis is option A, IgE, B, IgM, C, IgA, D, IgG. Correct option is D, IgG. A sickle cell is hemolyzed within option A, 120 days, B, 80 days, C, 40 to 60 days, and option D, 10 to 20 days. Correct option is D, 10 to 20 days. Signs and symptoms of sickle cell diseases first appear at age of option A, 1 month, B, after 4 months, C, after 6 months, and option D, 12 months. Correct option is B, after 4 months. A patient with sickle cell anemia, the disease present with option A, aplastic crisis, B, G6PD deficiency, C, vasospastic crisis, option D, iron crisis. Correct option is A, aplastic crisis. Systemic lupus erythematosus SLE may be related to the option A, hereditary spherocytosis, B, warm autoimmune hemolytic anemia, C, cold autoimmune hemolytic anemia, D, G6PD deficiency, and option E, hereditary elliptocytosis. Correct option is B, warm autoimmune hemolytic anemia. Cholelithiasis may be associated with option A, hemolytic anemia, B, G6PD deficiency, C, hereditary spherocytosis, option D, sickle cell disease, and option E, sideroblastic anemia. Correct option is D, sickle cell disease. Anemia caused by antibody production by the body against its cells. Option A, hemolytic anemia, B, autoimmune hemolytic anemia, C, microcytic anemia, option D, megaloblastic anemia, and option E, macrocytic anemia. Correct option is B, autoimmune hemolytic anemia. A warm autoimmune hemolytic anemia patient presents with option A, anemia, B, jaundice, C, splenomegaly, option D, all of the above, and option E, none of these. Correct option is D, all of the above. Pica is a characteristic symptom of option A, hemolytic anemia, B, megaloblastic anemia, C, G6PD deficiency, option D, iron deficiency anemia, and option E, aplastic anemia. Correct option is D, iron deficiency anemia. Coombs test may help in the detection of option A, megaloblastic anemia, B, microcytic anemia, C, warm hemolytic anemia, option D, none of the above, and option E, aplastic anemia. Correct option is C, warm hemolytic anemia. The primary storage form of iron is option A, hemosiderin, B, ferritin, C, Fe2, option D, glucagon. Correct option is B. Ferritin. About 90% of pregnant women in Pakistan suffer from option A. Megaloblastic anemia, B. Autoimmune hemolytic anemia, option C. Iron deficiency anemia, and option D. Hemolytic anemia, and option E. Sideroblastic anemia. Correct option is C. Iron deficiency anemia. Ferritin is primarily stored in option A. Blood, B. Kidney, C. Heart, option D. Liver. Correct option is D. Liver. HCT hematocrit level in an anemic woman is most probably option A. Less than 36, B. More than 45, C. Less than 30. Correct option is A. Less than 36. MCV, mean corpuscular volume, in normocytic anemia may range is option A. 50 to 60, B. 76 to 96, C. 60 to 70, option D. 80 to 100. Correct option is B. 76 to 96. In iron deficiency anemia, TIBC will option A. Increase, B. Decrease, C. Stay normal, option D. Slowly decrease. Correct option is A. Increase. In Prussian blue staining, iron is stained is option A. Purplish blue, B. Greenish blue, C. Reddish yellow, and option D. Black brown. Correct option is B. Greenish blue. Thank you for watching my videos.